Welcome to our infectious disease case presentation. This presentation was put together by Alex, Kim, and Alicia, and it is narrated by yours truly, Kyle Nickel. The other day we had a patient come in to us who is a 27-year-old female who was just along the Lake Superior hiking trails. She has complaints of her legs hurting more than usual and feeling feverish with a lack of appetite in the last 2 weeks. We asked our patient if she's found any ticks anywhere on herself when she was hiking, and if she did, how long she thought they were there. We asked about the conditions of the drinking water, asked her if she bruises easily, has experienced any nausea or vomiting, or any neurological symptoms such as a headache, visual disturbance, or paralysis, and we also asked if she's noticed a rash appear anywhere on her body. After taking the history, we find out that she has fever, chills, severe headache, muscle aches, nausea, vomiting, diarrhea, and a loss of appetite. So based off of these, our differential diagnosis list is Rocky Mountain spotted fever, tularemia, Lyme's disease, babesiosis, relapsing fever, and anaplasmosis. Based off of these signs and symptoms, we think that it's probably anaplasmosis, which can be confirmed using a blood test. Anaplasmosis is caused by the Anaplasma phagocytophilum. This is becoming a lot more prevalent in the U.S. within the last 20 years. It is spread by the black-legged tick, which is also known for spreading Lyme's disease, and people with autoimmune diseases, such as HIV, tend to be at a higher risk of developing this disease. So based on our DDX list, we referred the patients out for a blood test to look for a PCR reaction and the presence of IgG using the antigen A phagocytophilum. The IgM antibodies may also be high. So the PCR test is used to amplify the DNA extracted from the blood and can be helpful to diagnose this disease in the early stages. And then the IFA is looking for the IgG, and this test may appear negative the first week because the IgGs won't come until a little bit later on. The treatment options are the antibiotic doxycycline, and then you just continue that for a couple days until the fever is reduced. If clinical improvement does not occur within 3 days, reevaluate and treat for the Babesia infection instead. The patient should be admitted to the hospital, and treatment should never be delayed and should be taking antibiotics as soon as possible. The prognosis for this disease is typically very good. It is mostly seen in males who are over 40 years old. However, the other boxes show the increased risk for the disease and the severity of it. So if people are more immunocompromised, if they live near tick habitats, or they delay the treatment, it'll become more and more fatal. So there are biases when it comes to this. People who live in the country or spend their time in the woods without taking proper measures are going to come up with this disease more often. However, ticks can be found pretty much any place, so if you find grass, there really isn't as much bias because they can live anywhere. So in conclusion, avoid the infection of anaplasmosis by taking the preventative measures. The tick must be attached for 4 to 24 hours before anaplasmosis can occur, so immediately remove any ticks found on a full body inspection should occur immediately after outdoor activities, and then also apply repellents such as DEET to skin and clothing before any activity in areas that ticks might reside. If you take these steps, you will greatly reduce your risk of contracting anaplasmosis. And here are our references, and thank you very much for listening to our presentation.